Ankle sprains are a very common injury. The injury usually occurs when stepping on uneven surfaces and twisting the foot below the leg beyond its normal position or range of motion. The result can include mild damage, such as swelling and pain, to more severe damage, such as torn ligaments or damaged cartilage. Most people are well aware of common home remedies, including rest, ice, and compression wraps. Unfortunately, as many as 80% of sprained ankles end up with continued symptoms and problems. These can include lingering pain or instability and lack of balance that may make a person prone to repetitive injury and even falls later in life. If you have an ankle sprain, elevating and icing the ankle is the first thing you should do. However, being evaluated by a foot and ankle specialist is the best way to determine the extent of your injury. Just because you can still walk on that ankle doesn't mean you don't have a fracture or significant ligament tear. Initially, we will obtain x-rays to determine if you have sustained a fracture or dislocation injury. If we have suspicion of tearing of the ligaments around the ankle, an MRI is helpful to evaluate the ligaments and tendons as well as to look for chips in the cartilage. If you have incurred an ankle injury, make an appointment to see me immediately. The sooner an accurate diagnosis is made, the better your chances of avoiding chronic ankle problems.